All right, guys, welcome back to Underground Science. In this video, we'll be talking about leukocyte adhesion deficiency, okay? Let's go and get started. First things first, we should know that when we're talking about leukocyte adhesion deficiency, there's multiple types, okay? We'll be talking about type 1 in this video because that's the most common, all right? So we should know that leukocyte adhesion deficiency is autosomal recessive. So that means you need the defective copy from both your parents to get it, okay? So what's the defect that we're talking about? So you have a defect in the CD18 subunit, okay, of the integrins. All right. So for in this example, we'll be talking about neutrophils. So you have a defect in the CD18 subunit of your integrins, all right, which is present on your leukocytes, and we'll be talking about neutrophils in this example. Okay. So in order to understand this, let's understand how do leukocytes normally migrate into your tissues wherever the infection is occurring. All right. So if we have our blood vessel here, right? And on the blood vessel, we'll draw our endothelial cells, which represent like this, right? Let's say we have infection going on in our tissue, right? So we have some sort of pathogen that's infecting our tissue, causing inflammation, and we want white blood cells to come here, right? So we can fight off whatever pathogen is infecting us. So the first thing we would do is we would have to undergo the process of rolling, okay? So first we would do rolling, which would be basically where the leukocytes, in this case we'll be talking about neutrophils, okay? They slow down, and how do they slow down? They actually start binding to your selectins. Now remember, your endothelial cells have selectins, okay? So how are we going to represent that? Let's do selectins like that, okay? So these are our selectins. And the two main types of selectins that we should be talking about. So, okay, let's represent this, right? So that's what we're drawing on our endothelial cells. And these are going to represent P selectins and E selectins, okay? So we have selectins on our endothelial cells. And what's going to happen is these selectins, if we take a white blood cell, for example, that's flowing across, right? Let's actually draw our white blood cells in green. Let's represent that in green. Let's say these are neutrophils in this example, right? Our white blood cells, or neutrophils in this case, have something called sialyl Lewis X, all right? So if we draw that, let's just draw it like this, right? Let's say this is the sialyl Lewis X on our neutrophils or our leukocytes in general, right? So we're going to draw it like this. And this right here represents the sialyl Lewis X. Okay, sialyl Lewis X. Now, this molecule, the sialyl Lewis X on the leukocytes, is going to be the one to bind onto the selectins, that being the P selectins and E selectins. That's how the leukocytes slow down. All right. And this infection that's occurring, of course, this is leading to cytokine release and inflammation. And all that inflammation actually helps upregulate these selectins onto the surface of endothelial cells. So that's why these white blood cells are going to come over to the site of infection. And that's first step being rolling, where it's going to bind onto selectins on the endothelial cells via its sialyl Lewis X, right? And that's going to help the leukocytes slow down, all right, near the site of infection. Next, what's going to happen is called adhesion or tight adhesion, all right? So we already saw rolling. Now we're going to get adhesion. And here we have to talk about integrins and cellular adhesion molecules, all right? So let's draw another blood vessel. And let's draw our endothelial cells, okay? Now, what happens in adhesion? So we have certain cellular adhesion molecules, like ICAMs, for example, right? So let's draw that. Let's draw our ICAMs in orange. So let's say these are our ICAMs, something like this, right, on our endothelial cells. So we'll represent that here. Let's write that down. So these are representing our cellular adhesion molecules, specifically our ICAMs. Okay, ICAM type 1 in this case. ICAMs are present on our endothelial cells. They're cellular adhesion molecules, right? What ICAMs are going to do is they're going to firmly attach to the leukocytes. Okay, but how will they do that? Leukocytes have integrins on them. Okay, so again, we're representing leukocytes like this, right? So the leukocytes have certain beta integrins on them. So that we'll represent these integrins in a purple color. These integrins will attach to the ICAMs, or these cellular adhesion molecules that are present on the endothelial cells. This will cause tight adhesion. So now the leukocytes are firmly attached to the endothelial cells. And remember also, these leukocytes have the sialyl-Lewis X that's bound onto the T or E selectins, right? So now it's firmly attached. Now these leukocytes can actually go to the site of infection, which is called diapedesis or transmigration, where it's going to squeeze through the endothelium and go to the site of infection in our tissues. Okay, so it's going to squeeze between the endothelial cells and go to the site of infection, which is called transmigration, also diapedesis. And from here, our leukocytes can then be attracted to the site of infection. Let's say it's occurring over here, right? Let's say we have infection occurring here, where pathogens are infecting our tissue. That's releasing a lot of cytokines and complement proteins, right? Remember, are also there. Certain cytokines like interleukin 8 can attract neutrophils, C5a, leukotriene B4, and certain bacterial products too can attract our white blood cells, right? In this case, are neutrophils. And remember, leukotrienes, right, is produced it's produced during the breakdown of certain phospholipids. Remember, phospholipids are broken down by phospholipase A2 into arachidonic acid. And then remember, arachidonic acid can get acted by cyclooxygenase enzymes and be converted to certain prostaglandins or lipooxygenase enzymes and get converted to leukotrienes. Okay, one of them being leukotriene B4, which can attract and activate neutrophils. Okay, so cyclooxygenase versus lipooxygenase. So now that we know that, right, let's talk about type 1 leukocyte adhesion deficiency. Okay, so remember we said that on our leukocytes we have these beta integrins, right? Part of what makes up the beta integrins is CD18. It's a subunit, okay? So if I highlighted this part, let's say this part is the CD18 subunit, okay? Now, remember, in type 1 leukocyte adhesion deficiency, you have defective integrins, specifically CD18. So if these integrins do not work properly, right, you can't have tight adhesion onto your endothelium. So in this case, if we're talking about neutrophils, right, if these neutrophils don't have a proper integrin formation because they have defective CD18 subunit, this interaction between the cellular adhesion molecule, in this case the ICAM1, and the integrins cannot occur, right? If you can't occur, you can't adhere to the endothelium, right? And that means neutrophils cannot go from the blood to the site of infection. So then what can we see here? What are the certain clinical features or findings that you can see? So of course, if neutrophils can't squeeze across and go to the site of infection, one thing you can see is recurrent bacterial infections, right? Recurrent bacterial infections. All right, sweet. That's one clinical finding that we can see. Again, if neutrophils cannot properly adheres to the cellular adhesion molecules, ICAM1 in this case, because they have a defective integrin, specifically the CD18 subunit, they cannot go to the site of infection, which means they cannot fight bacteria, right? so that you're going to see recurrent bacterial infections. Now remember, what makes pus, right? What makes up pus? Neutrophils. Well, if neutrophils can't exit your bloodstream and go to the site of infection, will you have pus formation? No, right? So another thing you can see is no pus formation. Okay, sweet, right? Another thing, if your neutrophils, again, cannot exit your bloodstream, okay, and go to your tissues, that means you're going to have a lot of neutrophils in your bloodstream because they can't exit and go to your tissues. So then you'll see leukocytosis if you do a lab, right? In labs, you'll see leukocytosis or neutrophilia. So let's write that down. So another thing we'll see is neutrophilia or leukocytosis, right? Because the neutrophils are what? Trapped in circulation, okay? And another really important finding that we should discuss is when when the neonate is born, right? When the fetus, when you deliver the infant, okay, or when you deliver the newborn, right? What happens? So, of course, we know that you deliver the newborn and you have the umbilical cord, right? And we know that after 7 to 14 days, what happens to the umbilical cord? It gets degraded, right? And then it goes away. But in this case, that does not happen. You do not see degradation of the umbilical cord for up to 30 days or longer. All right. So again, normally when you deliver the newborn after birth, we know that the umbilical cord undergoes necrosis, right? Because of hypoxia. Because once you deliver the baby, the umbilical cord stops getting oxygen. That leads to necrosis. And we know after necrosis, you get acute inflammation. So neutrophils come in. And neutrophils are really good at releasing enzymes, reactive oxygen species, and whatnot to degrade whatever tissue it's in, right? And to promote inflammation. So neutrophils are highly important when it comes to degrading the umbilical cord. But if you have a beta 2 integrin defect, specifically the CD18 subunit, neutrophils can't come in your tissues, and one of those being your umbilical cord, right? So the neutrophils won't be able to cross and leave the blood vessel and go into the umbilical cord, which means you won't be able to degrade the umbilical cord, which means the umbilical cord will stay attached and it will not be degraded for up to greater than 30 days, all right, instead of the normal 7 to 14 days. Okay, so that's another finding is delayed separation of umbilical cord. All right, now I hope that explanation made sense too. Okay, because again, you need neutrophils to degrade tissue, right? That's undergone necrosis. But if you can't get the neutrophils out of your blood vessels and into your umbilical cord, then you can't degrade it, and therefore it will not separate in the normal span of 7 to 14 days, and instead it may take up to 30 days or longer. Okay, so the main findings that we should know is recurrent bacterial infections, no pus formation, neutrophilia, and delayed separation of your umbilical cord. And that's type 1 leukocyte adhesion deficiency. All right. So that's basically it for this video. Those are the main things to know about how type 1 leukocyte adhesion deficiency works. I hope this video made sense. I hope it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.